So on average, is there an average age or point in life at which people come into the office searching for bariatric or, being approved for bariatric surgery, or is it really all
No,
over the
there's
place?
kids all the way down to, I mean, most surgeons will cut off at about 75.
Wow.
So, I mean, it's, yeah, it's a full lifespan situation.
Wow, fair enough. What is the general, you said most people regain about 40%.
But people we see in our program will have
Gotcha.
gained back 40% of the weight
Hmm.
they've lost.
And then after that regain of the 40% of weight, I'm wondering, is the goal to reduce that further or kind of stay at that 40%?
I think there are a variety of different goals for patients
Yeah.
coming in. For some, it may be, my diabetes has come back since I've regained this weight after bariatric surgery. I
Mm,
don't want to be back on insulin again. So there may be scale based goals with regards to weight at which they feel most comfortable as you kind
mm,
of decrease some of the mechanical pressure of the extra body weight. For others, it may be kind of a cardiometabolic outcome where I don't want to be on 3 blood pressure medicines or I don't want to have to use insulin again. So the goal is really to improve health, and the weight reduction often tracks with that.
mm.
So what we do is we start appropriate medications based on their health profile and work on getting them close to their goals.
All right. When it comes to surgery, if someone has gained weight after surgery, what is the process, or is there a process for returning back to surgery again? Is that something that you all
Yeah.
face often?
So revisional surgeries are possible, and it all depends on what the mechanism is for the weight regain. There are many patients, for example, who have a history of adjustable gastric banding, who've had to have those removed because of device malfunction or because of weight regain, and they may transition to a different surgery, such as a sleeve gastrectomy or Roux-en-Y gastric bypass. Based on those, there can be additional revisions based on the anatomical changes that can be helpful, and those can be traditional surgical interventions with laparoscopic approaches, or there are also endoscopic approaches where they go in through the mouth and can make modifications to the
Mhm.
procedure that way.
And then just kind of speaking of these kind of new surgical approaches, are there any new bits of technology or strategies when it comes to surgery that you're particularly excited about or that have emerged recently? Or is it just like the classic, we've already figured out how to do this, and so if it isn't broke, don't fix it type thing?
There are some new surgical approaches which have not been widely adopted yet in the
Mm,
United States and not yet been cleared or approved by most insurance here. They are continuously working on surgical techniques and approaches, both traditional surgery and then endoscopic therapies, to hopefully provide less invasive means to help people to achieve significant weight loss.
mm. So are there any maybe specific surgical revisions or endoscopic procedures that you typically recommend for patients with significant reoccurrence, or how do you decide which of those are appropriate?
That's highly individualized, and I
Mm,
think it depends on a variety of different reasons, and it depends on a variety of different factors,
mm,
including what surgery they've had,
mm.
what kind of challenges they've experienced from both a weight or other disease recurrence perspective.